What if you could sit down once a week with a colleague who's a flat-out warrior? This colleague wasn't a stud in dental school. He struggled. He returned to practice in his hometown, an area once labeled by USA Today as the second worst place to live economically in the United States. And this very same colleague went on to establish an historically successful general practice known worldwide. What if you knew someone that wanted to take you by the hand and show you everything you need to know, from treatment planning to leadership, to maximizing your journey in dentistry, or just life? You ready to be inspired? Welcome to the Lionhearted. Hi everyone, Dr. Steve Rasner here. Welcome back to the Lionhearted Dental Podcast. The title of today's podcast is going to be, It's Time to Refine Your Case Presentations. And I know you've heard me talk about these things from different angles. But the angle that I'm going to take tonight, because it's so important on so many levels to your practice, and to you personally, actually, is that if you really are doing it, I give you a lot of ways to do what I describe as the lion-hearted way. But of all the things I am sure of, that I am dead on, it's case presentation and the approach to that would have the most and greatest impact on you both professionally and personally. And I'll explain why. Because if you do it with diligence and you do it correctly, and I just don't believe most of you are. And if you do it right, you never have to worry about selling anybody anything. And let me take that statement back. I said, run it back by you again. I said, if you do diligence to a proper approach to case presentation, what does the patient need? The whole aura that's going on when you walk into that treatment room for the first time and are meeting that patient. Have you ever thought about that? What's really going down? You don't think that patient's usually incredibly nervous, probably distrusting you to some extent? I think it's true. Listen, many of the new patients that come to see you have left their last dentist because he either retired, they walked in and met a new dentist, and they didn't get the memo that there's a new dentist in charge. This is very often how this really goes down. And sometimes these patients give that new dentist a chance, and sometimes they don't. And sometimes when they give them a chance, the rope is very thin on what will hold them to the practice since the original dentist has left. It could be something incredibly innocent that went wrong, that maybe somewhere inside your organization happened. And they've had it. How do I know? You know how I know, because you see the same things I do. And now they're in your office. You're number 2, or you could be number 3 or 4. That's happened to me, in line of who they're looking for. And they'll say something like, I had a dentist for 30 years and I just haven't been able to find anyone. And now they're with you. And is it an opportunity for you to add a believer? That's how I look at it. Add another person to that nucleus that you keep hearing me talk about that's incredibly important. Have you heard me talk about that? Have you heard me talk about how important it is to have a giant nucleus of patients? And for those of you that have not heard me before, I'm going to review it real quick. If you picture your family of patients up in this cloud, like the size of a hurricane, they're not all coming to you at the same time. Sometimes there'll be more of a percentage than others, and that's when you guys are killing it, when you notice you're very busy. Because in that nucleus are three categories of patients. There are patients who always do what you recommend. And they're the best. They don't miss hygiene appointments. You know what I'm talking about. You say, Mrs. Green, I think the best treatment for this is a crown. If that's what you think, doctor, right? You've heard that. Or an implant, or whatever you recommend. They haven't missed an appointment in 20 years. The only problem with them is there's not enough of them. Then you have patients you've treated before. Some of them you did big cases on, and they've kind of dropped off the radar. Maybe they left you. They probably did. Maybe they haven't. That just dentistry is not their priority right now. Okay? And then they come back one day. You don't ever barely remember. That's number 2 in that nucleus. And sometimes on a bad week of a bad month, bam, they're back in your schedule. And there's no better patient. There's no better new patient than a returning patient. You better believe that. When the patient hasn't been you and they come back, whew, I get a warm, fuzzy feeling. It's wonderful. And then the third patient is a patient that came to you that did not accept your treatment. In fact, you think they don't even like you, or you don't even remember that they were once there. That's usually me. And they call, and they're in the chair, on the schedule, and they want another consult. They might have been in your office years ago. And that's why you hear me say to you that the goal of a case presentation is for that patient to leave your office with a good vibe about this dental place, whether they accept treatment or not. And one way to do that I am positive I've never been better at, is not ever to make them feel that you're trying to sell them. In fact, you got to go out of your way to be crystal clear that you're not trying to talk them into treatment. You can talk them out of treatment. What I mean by that is a patient that has an atrophic mandible, that heard you're the best thing since sliced bread, and so they want you, not affordable dentures, to make them a denture, a lower denture. And then it becomes your job, if you really think you can improve the quality. I mean, if their last lower denture was just horrible in every way, I guess that would be an outlier, an exception. I haven't seen too many lower dentures in my life, or probably made any, that were just amazing. But your job is to have the integrity to be able to say, listen, I'd love to do that for you, and I know you believe in me. And that warms my heart. Of course it does. But that's really not what you should do. If you're getting by with this to any degree, I would tell you to save the money on a new denture. Take your wife to a trip this weekend, or buy her a gift that you would have spent on this denture. Because my job is to recommend for you things I think will definitely improve your oral health conditions. And you just have whatever you say at that point. I mean that. Have you ever done that? It is quite refreshing. And that patient may be back now. So that's why you hear me refer to increasing the size of that nucleus, hopefully of proactive advocates of your practice. Okay? We're going to come back to that in just a minute. Well, I'm going to give you some examples, like right now. I had 3 people in my office this week. different scenarios. And I want to give you an example of not selling somebody. In fact, really making it clear that that's not who you are. And one of the patients came in, and she had come to me about 4 months ago and reported a prior swelling on her upper right. And I could not clinically ascertain what it was from. It wasn't there when I was there. She was negative to percussion palpation. The x-rays were negative. I took a CBCT, and I wasn't sure. That's the truth. So I sent her, what I would do is I sent her for another opinion. I sent her to an endodontist. And the endodontist wasn't crystal clear, but thought there could be a fracture of one of two teeth. It was either 1.6 or 1.5, or in the United States, the first molar or second premolar. But the problem was she came back. And this woman had a cascade of many medical issues going on. And well dressed, by the way. Money was not an issue with this patient. Well dressed, I know her. Presents, alert, upper 70s, and I cannot replicate her symptoms again. And the consult was for a removal of number 5 based on the opinion of the endodontist. Again, if she has a fracture, it was so small I could not confirm it, either clinically, orally in the mouth, or even on a CBCT. I'm sure one of my brighter colleagues could, but I couldn't. So I told her, I said, listen, let's do this. Let's do nothing. I appreciate that, you're here today. That's my opinion. I believe it probably will come back. And when it comes back, the only negative of taking this approach is hopefully it's not a Saturday night. And I may not remember. Maybe it'll never come back. Maybe it'll be back. I said this to her too. Maybe it'll be back in a week, a month, a year. Let's at least wait to your next hygiene and see what's going on. That if I had told that patient, that patient's that one who does everything I would say. She in a heartbeat would have replaced number 5 with an implant. Wouldn't matter what the cost was, which is over $5,000, maybe $5,500 in my office to remove it, implant, crown, the whole thing. Second patient is the one I alluded to in my last week's podcast. I told you I had 2 patients cancel on me, which I never have happened. It was my whole day, by the way. They both were 3-hour plus patients. And when I got on the phone with this one, she wasn't coming in, so I was on the phone with her. And she was full of anxiety. And I know that I can eliminate that 95% plus of the time. So really it was hard for me because here I have a patient that's so scared that whatever I presented to her before wasn't getting through or working for her. I'm on the phone with her with a very gentle voice. And I told her, I said, look, at some point you have to do something. Because she had periodontal involvement, loose teeth, just not a good mouth. And I said, but you don't have to do it today. And she had paid us. So I have been paid significant money. And I told her, we can refund your money and you can, I don't know, you could get IV sedation through us or somewhere else. I am here to guide you. She just broke a 4-hour appointment on me. I wasn't very happy about it. And I don't remember the last time, and when I say that, I mean 10 years, that has happened to me. And then the last patient is an interesting one that you may be able to relate to. She comes in with her daughter, and they're lovely people, but the daughter is writing notes from day one. They've been in about 5 times, and I've done minimal treatment at this stage that I'm speaking to you. And I have given them 3 treatment plans because she really has 3 definitive ways to go. My point is, and they haven't committed yet. I have a very productive office. You've heard my numbers from time to time. And if you do diligence, for real, are you doing it? It's what you got to ask yourself because to case presentation. Because it has such an impact on everything else. And when you do it consistently, the way I have described, if you go back to my original podcast, 2018, I think, and after the introductory podcast, the first one I did, I am pretty certain the next 4 to 5 30-minute to, back then it could have been an hour, podcast are on case presentation. And I'm sure I haven't changed much since then, if at all. You need to do this to say, am I really... You guys hear what I hear. I want to tell you something. Most of the time, with the style of case presentations or new patient visits that I do, at some point early in the process, 10 or 15 minutes, I get this feeling, just as if you can see the sunset and it becomes day to night, that I have this patient if they can afford it. It is not a trust thing. That's a big thing. And the patient will often verbalize that past experiences in this situation of the consult, that they didn't even see the doctor, that he read a chart or visually had contact with them. And I think you guys know what I mean. Now, I know that Lionhearted dentists that listen to me aren't like that. But it's hard to believe that you couldn't improve a couple levels of what you're doing. Because when you do that, you don't have to talk anybody in anything. And you shouldn't, because there'll always be a high number that accept. When I look at my schedules right here of this past couple weeks, they are huge cases. By the way, they're not all huge implant surgical cases. A lot of my patients have missing teeth and have precision partial dentures done. It's rare that I do a conventional, regular cast class partial, unless the patient was wearing that for a reason, unless they're compromised and liked it and wanted it replaced. So, I don't know how much you remember my initial interactions with that new patient in my operatory, but they're worth reviewing just for a second. At that stage, when I walk in, think about it for a minute. That patient has had a pretty productive initial phone call because it's not an accident. Michelle, my new patient coordinator, can spend 15 to 20 minutes on a new patient that calls us. My other staff members will screen if Michelle's not free, which she often isn't, and sometimes to be quite candid with you, full disclosure, we always say our new MP coordinator can call you back within the hour. I'm sure sometimes it is not an hour. It's longer than an hour. And I don't advocate you doing that. I think it's not a good way, but sometimes you get so good at things like tennis, which I'm not, by the way, that you can make mistakes and still be successful because you've done everything else so well, so long. I'm being really candid with you tonight. And so they've already had this really unusually good initial contact, and she is very good at it. They've had a good initial whatever it is, 15 minutes in my office. They came in. It's the way I describe it to you. It's spa-like. That's what they're visually seeing. They are interacting with people who know the importance of smiling, using people's first names. You can kind of tell the way I'm talking to you right now of why so badly I want to meet you in person. I'm talking to my audience. Because there's so much that goes into everything I say. And there's so much that goes in to that first patient visit. And I believe today it's actually easier than ever to distinguish yourself. I've never seen dentistry so off target with everything. I mean that. I'm sure there's many, many great offices, but there's a tsunami often affected by corporate dentistry, in my opinion. It's off the track. It is. And it's not even often the corporation's fault. They bought a practice of a guy that or female that sweated it out and nurtured this practice for 30 plus years. And that can often change people when they're bought. In other words, it's not even the money that they've acquired. It's that they are not all in anymore. They're half in. Half in as in waiting to get out. And when you're not all in, your organization's not the same. And so I really believe it's an easy time. Those of you that are, when I say Lionhearted dentist, I mean somebody that really cares about every aspect of the patient experience of your organization. And I'm going to say something on the side right now that I've never said before. And if my own team's listening, they're not going to love it. But it's true. The hardest thing that has happened, and I got to finish the importance of the case presentation. But the worst thing that's happened that I now realize is maintaining a dedicated, focused staff has never been harder. And it's never been harder because there's not an abundance of those type of people to select and replace somebody on your team that could be burned out. And I'm experiencing that. I've never had trouble in the past. And you're talking to a guy that believes he can overcome anything. Which is partly why I think I became popular in the lecture circuit. Because that comes out and I speak a lot long enough. But this obstacle I never saw. And to be honest with you, it completely saddens me. Because I don't know what I'm dealing with anymore. I'm not saying my whole team. You've got on here and you heard me tell you that I have a team that has averaged 20 some years with me. Well, some of those people in the 20-year average don't have 20 years in. There's people with 40 and 30 and, which makes up for those that have been with me for 5 or 10. And it started kind of with COVID. And I don't know what the relation was. Paying people for not working, I'm really not sure. But it's different. And I know you can relate. And right this second, I don't have an answer. I have lectures or portions of my presentations on how to motivate and keep teams. And I've done it for quite a long time. But it is difficult. I am seeing it with my own eyes and feeling it with my heart to get people to perform at the same level that we used to. And I don't mean working on a zillion patients. I mean simply doing the same protocols that we've always done and thinking it's okay to stop them without talking to me. Or for whatever reason they deemed too busy, it's harder, it's unbelievable. I will fix it, and I'll tell you how I'm going to fix it. I believe there are staff members that want to be a part of Lionhearted type of practices, or your practice, whatever you want to call it. I think they're harder than ever to find. They've always been hard to find, to be honest, but not like now, as I've just alluded to. But I'm going to find them. Because some people love to be in dentistry, just like they do any other industry, because for whatever reason, that's what they're in, that's what they've dedicated themselves, and they know they're not the doctor, but they're a part of a team that is able to produce this beautiful product of clinical dentistry. Whether it's a front desk person, a hygienist, a dental assistant, it really requires a family to produce a very, very high level product. The product of excellence. It's hard. Can't begin to do it alone. And I know I got sidetracked here because part of what that patient experienced on that new patient exam is people in the hallways. I used to feel that I could say anything to my staff. I need you to smile. I need you to have eye contact when you're in a hallway and pass a patient. It makes us different. By the way, I learned that, first of all, it's intuitive, but I learned that from 5-star hotels. They don't walk by you with their head down. Whether they're cleaning the windows with a squeegee. And that's just one of 100 points I can make with you right this minute about what projects you differently, what makes you feel excellent to that new patient that came in, or your old ones that are in recall. It's everything. It's attitude. It's them seeing and feeling that you have teamwork, that you have people that want to be there, that are happy to provide care. Just like when you go into the Four Seasons, Ritz-Carlton, whatever industry is offering a restaurant. You've all experienced it. The problem is there's more of an abundance in other industries where we don't get that. Where you sit there and nobody even notices that you're standing there. So let me go back and finish, because there we go, we're up to 27 minutes already. I'll go back next week. This is too important. You need to do your homework between now and then. Your homework assignment is go back and look, what is your new patient experience? What is they're two different things, your case presentation history. What do you do? What do you have even a thing? Like a thing that you follow? I'll tell you the initial comments my patients hear. And I've said this to you before. They're in that room, I would say a great majority of time, 70% or more. There are two people in there. There's the x-rays have been taken. The spouse or significant other is brought back into these nice chairs I've ordered a couple years ago, because I used to stick them in the dental assistant chair, and I always feared them falling over and this being just a catastrophe that I didn't sign up for. So we got these nice little chairs on wheels. They're comfy, they're portable, they fold up nicely, they're nice. You can ask me where I got them. I can take a picture and send them to you. By the way, my email is drrasner, R-A-S-N-E-R, at AOL.com. I know, it's funny, at AOL.com. Well, that's my email. So I walk in, I usually say something, so where are you from? And then I say, I want to tell you two distinct things about this practice that I know you'll find different, and I know that you'll like both of them. It's exactly how I talk, no matter who it is. And I'll say, and I've alluded to this with you before, about the fact that whether you're a dentist, a teacher, a cop, a lawyer, or whatever they are, I'll often ask them, what did they do for an occupation? And I'll ask their significant other also. And I said, I know that's odd to ask you that, but the reason I'm asking you that is because it doesn't matter what you do. A lot of people are half in their profession. This is how I open my new patient conversation. And I have a reason for doing it. That's what I said. And I said, and it's true in my profession, because it's a very easy profession to get burned out in. It's hard. But that didn't happen to me. I couldn't believe, and when they giggle when I say this, in my 20s, that I was allowed to do all this stuff. And I loved it. I felt like I was an astronaut. I don't know where I got that analogy from, but it's a good one to use. And I said I felt like I wanted to be the best astronaut alive. So I did what anybody would do. I kept training and training and training. And I went into, I have a lot of deviations where I go when I'm saying this. You guys like it? If you like this, then write to me and tell me, because I can expand. I know I've done it before, but I feel like I'm at a good place describing it to you right now. Because that is really what's happening very early on in this conversation. I do the astronaut story. And I tell them how I trained my whole life. And I said, of all the things I learned, and I've learned a lot, a concept of what to do when is what I learned the most. Of what to do when. And to be honest with you, Mrs. Green, that's what we're doing right now. You're coming in here. You have what we call a chief complaint, or the reason you came in. And by the way, sometimes I ask them that right then and there. And what is the right thing to tell you? It's not so easy. Sometimes I can tell you in a couple minutes. And sometimes I got to bring you back. I know your time's valuable. But I'm going to do what's best for you, not for me. And then the second thing that's so, I think, great about coming here, and don't take this wrong, is I'm not here to sell you anything. I don't care if you do a big case, if you need that, if that's what I think you need. What I care about is respecting the fact that you came to me, and I want to give you the best advice I can give that fits you. When I have this conversation, guys, I'm talking to my audience now, you guys. Sometimes I can see that they need implants or crowns, and they've never done a thing because I have their x-rays to my right. And that brings up good old Dr. Joe stories. And I'm going to leave you with that. We'll take that up next week, of this process that you've heard me talk about, but it sets the table for everything. When I look at these schedules, they're 2 and 3 hour appointments or more with gigantic treatment plans from people who've never had anything done. These aren't redos. These are people that have had, oh my God, I had somebody with an acrylic partial with wrought wire clasp that had broken and self-repaired. I could see it. She was giggling about it. For 30 years. That's how long she had the partial she had. Good old Dr. Joes aren't Lionhearted dentists. And we'll leave it at that. You guys have a great week. Feel like I'm giving you some good stuff lately. I hope I am. Email me, drrasner@aol.com. That ought to give you a laugh after you listen to me today. See you next week.